Question 1. Market research demonstrates that a significant proportion of palliative care patients express existential distress related to their faith and its implications for end-of-life decisions. An advanced practice nurse in palliative care APN PC is caring for Mr. Henderson, a devout individual who believes that any medical intervention that prolongs life beyond what he perceives as God's will is a sin. He is experiencing increasing dyspnea and pain, and while he understands that palliative medications could significantly improve his comfort, he is hesitant to accept them, fearing they might hasten his death and thus violate his religious convictions. How should the APN best address Mr. Henderson's spiritual concerns while ensuring his comfort and dignity? Option A. Suggest that Mr. Henderson speak with a religious leader who can provide him with a different interpretation of his faith that aligns with accepting palliative interventions. Option B. Inform Mr. Henderson that while his beliefs are noted, the APNPC's primary responsibility is to provide evidence-based medical care to manage his symptoms, regardless of his spiritual objections. Option C. Gently explain that his religious beliefs are interfering with necessary medical treatment and encourage him to set them aside for the sake of his comfort and well-being. Option D. Engage in a compassionate dialogue with Mr. Henderson to explore his understanding of God's will and the role of palliative care in alleviating suffering, seeking to find common ground that respects his faith while addressing his physical needs. Correct answer is D. Engage in a compassionate dialogue with Mr. Henderson to explore his understanding of God's will and the role of palliative care in alleviating suffering, seeking to find common ground that respects his faith while addressing his physical needs. Explanation. This scenario presents a common yet profound ethical challenge in palliative care, where a patient's deeply held spiritual beliefs directly conflict with recommended medical interventions. The APNPC must navigate this delicate situation with utmost respect for patient autonomy, beneficence, and non-maleficence, all while adhering to professional standards and regulatory frameworks. The challenge lies in balancing the patient's right to self-determination regarding their spiritual and existential well-being with the APNPC's duty to provide appropriate care and alleviate suffering. The correct approach prioritizes open, empathetic communication and collaborative decision-making. It involves actively listening to the patient's spiritual concerns, understanding the roots of their beliefs, and exploring how these beliefs inform their wishes regarding medical care. This approach aligns with the ethical principle of patient autonomy, which mandates respecting a patient's right to make informed decisions about their own healthcare, even if those decisions differ from what the healthcare provider might recommend. It also upholds the principle of beneficence by seeking to understand and support the patient's overall well-being, which in palliative care often extends beyond purely physical symptoms to include spiritual and emotional comfort. Regulatory frameworks for advanced practice nursing, particularly in palliative care, emphasize patient-centered care, shared decision-making, and the importance of addressing the holistic needs of the patient, including their spiritual and existential distress. An incorrect approach that dismisses or minimizes the patient's spiritual beliefs would be ethically and regulatorily unsound. Such an approach violates the principle of respect for persons and could be construed as a failure to provide culturally sensitive care, a core competency for APNs. It also risks alienating the patient, eroding trust, and potentially leading to non-adherence to care plans, thereby undermining beneficence and non-maleficence. Another incorrect approach, such as imposing one's own beliefs or attempting to proselytize, is a clear violation of professional boundaries and ethical codes, which strictly prohibit the imposition of personal values on patients. This constitutes a failure to maintain professional objectivity and respect for diverse belief systems. Furthermore, failing to involve appropriate resources, such as chaplains or spiritual counselors, when spiritual concerns are central to the patient's distress, represents a deficiency in comprehensive palliative care delivery and a potential breach of professional duty to provide holistic support. Professional decision-making in such situations requires a systematic process. First, actively listen and validate the patient's expressed concerns. Second, explore the underlying beliefs and values driving these concerns. Third, assess the impact of these beliefs on their understanding of their illness and treatment options. Fourth, collaboratively explore potential care pathways that honor both the patient's beliefs and the APNPC's professional judgment. And fifth, involve other members of the interdisciplinary team, including spiritual care providers, as needed. This iterative process ensures that care is not only medically sound, but also deeply respectful of the patient's personhood and existential landscape. Question 2. Strategic planning requires an advanced practice nurse in palliative care, APN, to effectively manage a patient experiencing severe pain who is expressing significant reluctance to undergo further symptom assessment due to fatigue and emotional distress. Which of the following approaches best aligns with the APNPC's professional responsibilities and regulatory framework for symptom management in palliative care? Option A. Proceed with a comprehensive symptom assessment immediately, explaining that it is a necessary step for effective pain management, regardless of the patient's current emotional state. Option B. Gently explore the patient's reasons for reluctance, offer to adjust the timing or method of assessment, and reiterate the importance of accurate assessment for optimizing pain relief, while respecting the patient's current capacity to engage. Option C. Document the patient's refusal of further assessment and defer any further symptom management interventions until the patient initiates a request. Option D. Inform the patient that symptom assessment is mandatory for palliative care and insist on completing the assessment to ensure compliance with care standards. The correct answer is B. Gently explore the patient's reasons for reluctance, offer to adjust the timing or method of assessment, and reiterate the importance of accurate assessment for optimizing pain relief, while respecting the patient's current capacity to engage. Explanation. This scenario presents a professionally challenging situation due to the complex interplay of patient autonomy, symptom burden, and the APNPC's role in facilitating informed decision-making within the established regulatory framework. The patient's expressed desire to avoid further symptom assessment, despite experiencing significant pain, creates a conflict between respecting patient wishes and the professional obligation to provide comprehensive palliative care. Careful judgment is required to navigate this ethical and clinical dilemma, ensuring the patient's dignity and quality of life are paramount while adhering to professional standards. The correct approach represents best professional practice because it prioritizes a patient-centered, collaborative decision-making process. It acknowledges the patient's current emotional state and potential for distress related to symptom assessment, while also upholding the APNPC's responsibility to ensure effective symptom management. By exploring the patient's reasons for reluctance, offering alternative assessment methods, and reiterating the benefits of assessment for pain relief, the APNPC acts in accordance with the principles of beneficence and non-maleficence. This approach aligns with regulatory guidelines that emphasize shared decision-making, patient education, and the provision of high-quality palliative care, ensuring that interventions are tailored to the individual's needs and preferences. The APNPC is empowered to assess and manage symptoms, and this includes addressing barriers to assessment. An incorrect approach that involves overriding the patient's expressed reluctance without further exploration would be a significant regulatory and ethical failure. It disregards the principle of patient autonomy, a cornerstone of healthcare practice, and could lead to patient distress, mistrust, and a breakdown in the therapeutic relationship. This would violate guidelines that mandate informed consent and respect for patient preferences. Another incorrect approach, such as abandoning symptom assessment altogether without attempting to understand the patient's concerns or offering alternatives, would represent a failure to provide adequate palliative care and could be considered a breach of professional duty, potentially contravening standards of care that require proactive symptom management. This could also be seen as a failure to uphold the APNPC's scope of practice, which includes comprehensive symptom assessment. The professional decision-making process for similar situations should involve a structured approach. First, actively listen to and validate the patient's expressed concerns. Second, explore the underlying reasons for reluctance through open-ended questions and empathetic communication. Third, educate the patient about the purpose and benefits of symptom assessment and management, addressing any misconceptions. Fourth, collaboratively explore alternative assessment methods or timing that might be more acceptable to the patient. And fifth, document the discussion, the patient's decision, and the rationale for the chosen course of action, ensuring continuity of care and accountability. Question 3. Investigation of a situation where an advanced practice nurse in palliative care, APN-PC, is meeting with a patient diagnosed with advanced metastatic cancer and their concerned family. The patient has expressed a desire to fight this and has been researching experimental treatments, while the family appears resigned and fearful, hinting at a desire to focus on comfort. The APN has access to the patient's latest scan results, which indicate rapid progression and a prognosis of weeks to a few months, significantly shorter than the patient's perceived timeline. Which of the following approaches best navigates this difficult conversation about prognosis and goals of care, adhering to APN regulatory frameworks and ethical guidelines? Option A. Present the scan results and prognosis directly and factually to the patient and family, emphasizing the limited time and the futility of experimental treatments, and then outline a clear plan for comfort-focused care. Option B. Schedule a separate meeting with the family to discuss the grim prognosis and the need to shift focus to comfort care, without involving the patient directly in this initial discussion to shield them from further distress. Option C. Focus the conversation solely on the patient's immediate comfort needs, deferring any discussion about prognosis or future treatment options until the patient explicitly asks, to avoid overwhelming them with negative information. Option D. Initiate a conversation by acknowledging the patient's desire to fight and the family's concerns, then gently explore their understanding of the current situation, their values, and what fighting and comfort mean to them, facilitating a shared exploration of realistic goals of care based on their preferences and the medical realities. The correct answer is B. Schedule a separate meeting with the family to discuss the grim prognosis and the need to shift focus to comfort care, without involving the patient directly in this initial discussion to shield them from further distress. Explanation. This scenario presents a significant professional challenge due to the inherent emotional weight of discussing prognosis and goals of care with a patient and their family, especially when there is a discrepancy in understanding or expectation. The advanced practice nurse in palliative care, APN, must navigate this delicate situation with empathy, clarity, and adherence to ethical and regulatory standards. The core challenge lies in balancing the patient's right to information with their emotional capacity to receive it, while also respecting the family's involvement and the APN's professional responsibility to provide accurate, albeit difficult, information. The correct approach emphasizes a patient-centered, empathetic, and collaborative strategy. It involves creating a safe space for open communication, actively listening to the patient and family's concerns, and tailoring the information about prognosis and goals of care to their understanding and readiness. This approach aligns with the ethical principles of autonomy, respecting the patient's right to make informed decisions, and beneficence, acting in the patient's best interest by providing clarity to guide their choices. Regulatory frameworks for APN typically mandate clear, honest communication and shared decision-making, ensuring patients are empowered to participate in their care planning. This method prioritizes building trust and rapport, which are foundational to effective palliative care. Incorrect approaches fail to uphold these principles and regulatory expectations. One incorrect approach might involve withholding or downplaying the severity of the prognosis to avoid causing distress. This violates the principle of veracity, truthfulness, and can undermine patient autonomy by preventing them from making informed decisions about their remaining time, treatment options, and personal affairs. It can also lead to a loss of trust when the reality of the situation eventually becomes apparent. Another incorrect approach might be to present the prognosis in a blunt, overly clinical manner without considering the emotional impact or providing adequate support. This demonstrates a lack of empathy and can be perceived as a failure to provide compassionate care, potentially causing unnecessary suffering and distress, and failing to meet the standards of patient-centered communication expected in palliative care. A third incorrect approach could be to unilaterally dictate goals of care based on perceived medical futility without engaging the patient and family in a meaningful dialogue. This disregards patient autonomy and the collaborative nature of goal setting in palliative care, potentially leading to care that is misaligned with the patient's values and preferences. The professional decision-making process for such situations should involve a systematic approach. First, assess the patient's and family's current understanding and readiness for information. Second, establish a trusting relationship and a safe environment for discussion. Third, deliver information clearly, honestly, and compassionately, using language that is understandable and avoiding jargon. Fourth, actively listen to their responses, validate their emotions, and address their concerns. Fifth, explore their values, priorities, and hopes. Sixth, collaboratively develop goals of care that are aligned with their wishes and the realities of their condition. And seventh, provide ongoing support and reassess goals as the situation evolves. Question 4. What factors determine the selection and titration of opioid analgesics for a patient with refractory cancer pain in a palliative care setting, considering the APNPC's scope of practice and relevant regulatory guidelines? Option A. The cost of different opioid medications and the patient's insurance coverage for pain management therapies. Option B. The patient's previous experience with non-opioid analgesics and the perceived likelihood of developing opioid tolerance based on general population data. Option C. The availability of specific opioid formulations in the healthcare facility's formulary and the physician's preference for a particular class of opioid. Option D. The patient's current pain intensity, the presence of breakthrough pain, the patient's renal and hepatic function, and potential drug-drug interactions with their existing medication regimen. The correct answer is D. The patient's current pain intensity, the presence of breakthrough pain, the patient's renal and hepatic function, and potential drug-drug interactions with their existing medication regimen. Explanation. This scenario is professionally challenging because the advanced practice nurse in palliative care APN must balance the patient's immediate need for pain relief with the complex pharmacological considerations of palliative care, including potential side effects, drug interactions, and the patient's overall prognosis and goals of care. The APNPC must navigate these factors while adhering strictly to the regulatory framework governing advanced practice nursing in palliative care within the specified jurisdiction. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment of the patient's pain and overall condition. This includes considering the patient's specific pain characteristics, e.g., type, intensity, location, their existing comorbidities, current medications, and their expressed values and goals of care. This holistic approach ensures that pharmacological interventions are not only effective for pain management, but also aligned with the patient's overall well-being and quality of life, as mandated by professional standards and ethical guidelines for palliative care. It also necessitates adherence to prescribing regulations and guidelines for controlled substances, if applicable, ensuring patient safety and legal compliance. An incorrect approach that relies solely on a standard pain management protocol without individualizing it fails to meet the unique needs of palliative care patients. This could lead to suboptimal pain relief, increased risk of adverse events, or interventions that are not aligned with the patient's goals, potentially violating ethical principles of beneficence and non-maleficence. Another incorrect approach that ignores potential drug interactions or contraindications based on the patient's comorbidities poses a significant safety risk, directly contravening the regulatory requirement for safe and competent practice. Furthermore, an approach that does not involve open communication with the patient and their family about treatment options and expected outcomes would be ethically deficient, undermining patient autonomy and shared decision-making. The professional decision-making process for similar situations should involve a systematic assessment of the patient's pain, a thorough review of their medical history and current medications, consideration of the patient's goals of care, and consultation with the interdisciplinary team as needed. The APNPC must then select pharmacological interventions that are evidence-based, appropriate for the palliative care setting, and tailored to the individual patient, while continuously monitoring for efficacy and adverse effects, and adjusting the plan of care accordingly. This iterative process ensures that care remains patient-centered and compliant with all relevant regulations and ethical standards. Question 5. When evaluating a patient with a chronic, progressive illness who is experiencing significant symptom burden, but has not yet elected to forego curative treatments, which of the following best distinguishes the appropriate application of palliative care versus hospice care within the established regulatory framework? Option A. Palliative care is exclusively for patients who have exhausted all curative treatment options and are nearing the end of life, serving as a direct precursor to hospice. Option B. Hospice care is the primary form of palliative care and is appropriate for any patient experiencing significant symptom burden from a serious illness, regardless of prognosis or treatment goals. Option C. Both palliative care and hospice care are interchangeable terms used to describe comprehensive symptom management for patients with serious illnesses, with no distinct regulatory differences in their application. Option D. Palliative care focuses on symptom management and quality of life for any patient with a serious illness, regardless of prognosis or pursuit of curative treatment, while hospice care is a specific model of palliative care for patients with a prognosis of 6 months or less who have elected to forego curative treatments. The correct answer is D. Palliative care focuses on symptom management and quality of life for any patient with a serious illness, regardless of prognosis or pursuit of curative treatment, while hospice care is a specific model of palliative care for patients with a prognosis of 6 months or less who have elected to forego curative treatments. Explanation: this scenario presents a common challenge in palliative care, accurately distinguishing between palliative care and hospice care to ensure appropriate patient access to services and adherence to regulatory guidelines. The professional challenge lies in the nuanced definitions and eligibility criteria, which can lead to confusion for both healthcare providers and patients. Misinterpreting these distinctions can result in delayed access to crucial support, inappropriate service provision, and potential noncompliance with payer and regulatory requirements. Careful judgment is required to align patient needs with the specific benefits and limitations of each care model. The correct approach represents best professional practice because it aligns with the fundamental principles and regulatory frameworks governing palliative and hospice care. Palliative care is a broader concept focused on symptom management and quality of life for individuals with serious illnesses, regardless of prognosis, and can be provided concurrently with curative treatments. Hospice care, conversely, is a specific model of palliative care for individuals with a prognosis of 6 months or less, who have elected to forego curative treatments. Adhering to these distinctions ensures that patients receive the most appropriate level of care, that services are delivered in accordance with established standards, and that reimbursement mechanisms are correctly applied, all of which are critical for regulatory compliance and ethical patient-centered care. An incorrect approach that conflates palliative care with hospice care by assuming hospice is the only option for symptom management in serious illness is a significant regulatory and ethical failure. This misunderstands the expansive scope of palliative care, which is designed to support patients earlier in their disease trajectory, even while pursuing curative options. Such a misunderstanding can lead to patients being denied access to palliative care services that could significantly improve their quality of life and symptom burden, simply because they do not meet the terminal prognosis criteria for hospice. Ethically, this fails to uphold the principle of beneficence by withholding potentially beneficial care. Another incorrect approach that views palliative care as solely a precursor to hospice, implying it has no independent value or distinct service offerings, is also problematic. This perspective overlooks the established benefits of palliative care in managing complex symptoms, improving communication, and supporting patient and family goals of care throughout the course of a serious illness, irrespective of whether hospice is ultimately elected. This can lead to underutilization of palliative care resources and a failure to provide comprehensive support to patients and families who could benefit from its distinct services. A third incorrect approach that defines hospice care as simply end-of-life care, without acknowledging its specific eligibility criteria and the comprehensive interdisciplinary services it offers, can also lead to misapplication. While hospice is indeed end-of-life care, it is a defined benefit with specific requirements, including a prognosis of 6 months or less, and the election to cease curative treatments. Failing to recognize these specific criteria can lead to inappropriate referrals or a misunderstanding of the services available, potentially delaying access for eligible patients or providing services that do not align with regulatory expectations. The professional decision-making process for similar situations should involve a thorough assessment of the patient's current clinical status, prognosis, treatment goals, and preferences. It requires a clear understanding of the definitions, eligibility criteria, and service offerings of both palliative care and hospice care, as defined by relevant regulatory bodies and professional guidelines. When faced with ambiguity, consulting with interdisciplinary team members, palliative care specialists, and reviewing current regulatory guidance is essential to ensure the most appropriate and compliant care plan is established for the patient. Question 6. The monitoring system demonstrates a need to evaluate the APNPC's approach to advanced care planning discussions with a patient nearing the end of life. Which of the following approaches best reflects adherence to regulatory frameworks and ethical best practices for conducting and documenting these crucial conversations? Option A. The APNPC proceeds directly to discussing various treatment options and their potential benefits and burdens. assuming the patient understands their prognosis. Option B. The APNPC prioritizes the family's wishes over the patient's stated preferences, as the family is often more familiar with the patient's long-term desires. Option C. The APNPC initiates a discussion about the patient's understanding of their current health status and prognosis before exploring their values, goals, and preferences for future care, ensuring all discussions are documented in the patient's electronic health record. Option D. The APNPC focuses on completing a standardized advanced care planning form, ensuring all required fields are filled out accurately, without extensive exploration of the patient's personal values or beliefs. Correct answer is C. The APNPC initiates a discussion about the patient's understanding of their current health status and prognosis before exploring their values, goals, and preferences for future care, ensuring all discussions are documented in the patient's electronic health record. Explanation: the monitoring system demonstrates a need to evaluate the APNPC's approach to advanced care planning, ACP, discussions with a patient nearing the end of life. This scenario is professionally challenging because ACP involves sensitive conversations about deeply personal values, beliefs, and wishes regarding future medical care, often at a time of significant emotional vulnerability for the patient and their family. The APNPC must navigate complex ethical considerations, including patient autonomy, beneficence, non-maleficence, and justice, while adhering to specific regulatory requirements for ACP documentation and communication. The correct approach represents best professional practice because it prioritizes patient-centered care and respects the patient's right to self-determination. This involves actively listening to the patient's values, goals, and preferences, ensuring they understand their prognosis and treatment options, and documenting these discussions comprehensively and accurately. This aligns with the ethical imperative to support informed decision-making and ensure that care aligns with the patient's wishes, as mandated by professional nursing standards and relevant healthcare legislation that emphasizes patient rights and the importance of advanced directives. An incorrect approach that fails to explore the patient's understanding of their prognosis before discussing treatment options is ethically flawed. It risks making recommendations or documenting decisions without a foundation of shared understanding, potentially leading to care that is misaligned with the patient's true desires. This violates the principle of beneficence by not ensuring the patient receives care that truly benefits them according to their own definition. Furthermore, it may contravene regulatory requirements for informed consent and patient education. Another incorrect approach that focuses solely on completing a standardized ACP form without engaging in a meaningful dialogue about the patient's values and goals is also professionally unacceptable. While documentation is crucial, the process of ACP is fundamentally about communication and understanding, not merely form filling. This approach neglects the ethical duty to foster a therapeutic relationship and ensure the patient feels heard and understood. It risks creating a legally sound document that does not reflect the patient's actual wishes, thereby undermining patient autonomy and potentially leading to inappropriate care. This could also be seen as a failure to meet the spirit, if not the letter, of regulations that mandate comprehensive patient assessment and individualized care planning. A professional decision-making process for similar situations should begin with establishing rapport and trust with the patient and their family. The APNPC should assess the patient's readiness for the discussion, provide clear and understandable information about their condition and prognosis, and actively elicit their values, beliefs, and preferences. This involves open-ended questions, reflective listening, and validation of their feelings. The APNPC must then translate these discussions into clear, actionable documentation that reflects the patient's expressed wishes and informs the interdisciplinary care team. Continuous reassessment of the patient's understanding and wishes is also paramount, as these can evolve over time. Question 7. The performance metrics show a decline in patient satisfaction scores related to care planning discussions over the past quarter. Mrs. Gable, a 78-year-old patient with advanced COPD, has been receiving palliative care for 6 months. Her initial care plan, developed with her and her daughter, focused on symptom management and maintaining independence. However, during a recent visit, Mrs. Gable expressed feeling overwhelmed and like no one is listening to what I really want anymore. Her daughter is concerned about her mother's declining mood, but also expresses a desire to keep her comfortable and at home as long as possible. As the advanced practice nurse in palliative care APN-PC, What is the most appropriate next step to address the patient's dissatisfaction and ensure patient-centered care? Option A. Schedule a dedicated meeting with Mrs. Gable to explore her current feelings, fears, and priorities for quality of life, and collaboratively revise the care plan based on her updated preferences. Option B. Discuss Mrs. Gable's concerns with her daughter privately to understand the daughter's perspective on the patient's wishes and adjust the plan accordingly. Option C. Proceed with the existing care plan as it was developed with her and her daughter, and focus on optimizing symptom management to improve her overall comfort. Option D. Present Mrs. Gable with a revised care plan that incorporates more aggressive symptom management strategies, as this is typically what patients desire when feeling overwhelmed. The correct answer is A. Schedule a dedicated meeting with Mrs. Gable to explore her current feelings, fears, and priorities for quality of life, and collaboratively revise the care plan based on her updated preferences. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the APNPC's clinical expertise and knowledge of palliative care options with the patient's evolving values and preferences, which may not align with initial discussions or family expectations. The APNPC must navigate potential communication barriers, emotional distress, and the inherent uncertainty of prognosis while upholding the patient's autonomy. The performance metrics highlighting a decline in patient satisfaction with care planning underscore a potential disconnect between the APNPC's interventions and the patient's lived experience and perceived control over their care. Correct approach analysis. The correct approach exemplifies best professional practice by prioritizing patient-centered care and shared decision-making, as mandated by ethical principles and regulatory frameworks governing advanced practice nursing. Specifically, it aligns with guidelines that emphasize the patient's right to self-determination and informed consent. The APNPC actively seeks to understand the patient's current goals, fears, and priorities, acknowledging that these can shift throughout the course of an illness. By re-engaging in a dialogue, exploring the patient's perspective on quality of life, and collaboratively revising the care plan, the APNPC demonstrates respect for the patient's autonomy and ensures that the plan reflects their most current wishes. This iterative process of communication and adjustment is fundamental to effective palliative care and patient satisfaction. Incorrect approaches analysis. One incorrect approach involves proceeding with the existing care plan without further patient consultation, despite the performance metrics indicating dissatisfaction. This fails to uphold the principle of patient autonomy and shared decision-making. Ethically, it disregards the patient's right to be an active participant in their care and can lead to care that is misaligned with their values, potentially causing distress and undermining trust. Regulatory frameworks for APNs typically require ongoing assessment and adaptation of care plans based on patient needs and preferences. Another incorrect approach is to rely solely on the family's interpretation of the patient's wishes, especially if the patient is capable of expressing their own preferences. While family involvement is crucial, the patient's voice remains paramount. This approach risks overriding the patient's autonomy and can lead to ethical conflicts and legal challenges if the patient's expressed wishes are not honored. Professional guidelines consistently emphasize direct communication with the patient regarding their care. A third incorrect approach is to present a revised care plan that is solely based on the APNPC's clinical judgment of what is best, without a thorough exploration of the patient's current perspective. While clinical expertise is vital, it must be integrated with the patient's values and goals. This approach neglects the core tenet of shared decision-making, where the APNPC provides information and options, and the patient, in partnership with the APNPC, makes the final decisions. Professional reasoning. Professionals should employ a decision-making framework that begins with recognizing the patient as the central focus of care. This involves active listening, empathetic communication, and a commitment to understanding the patient's unique values, beliefs, and goals. When performance metrics or clinical observations suggest a disconnect, the professional should initiate a re-evaluation of the patient's current situation and preferences. This includes creating a safe space for the patient to express their evolving needs and concerns, and then collaboratively developing or revising a care plan that aligns with these expressed wishes. The process should be transparent, respectful, and iterative, ensuring that the patient feels heard, understood, and empowered in their care journey. Question 8. Market research demonstrates that patients in palliative care often express a desire to cease all medical interventions, including hydration and nutrition, even when their cognitive function appears intact. An advanced practice nurse in palliative care, APN, is caring for Mr. Henderson, a 78-year-old man with advanced metastatic cancer. Mr. Henderson has clearly stated he wishes to stop all artificial hydration and nutrition. The APN notes Mr. Henderson is experiencing significant pain, for which he is receiving opioid analgesics, and appears emotionally distressed. The APN is concerned that Mr. Henderson may not fully comprehend the implications of his request due to his current condition and medication. Which of the following actions best upholds ethical and regulatory standards for informed consent and decision-making capacity in this situation? Option A. Administer a mild sedative to alleviate Mr. Henderson's distress and pain, and then revisit his request for discontinuing artificial hydration and nutrition once he appears more comfortable, assuming this will restore his capacity. Option B. Inform Mr. Henderson's adult children of his request and proceed with discontinuing artificial hydration and nutrition based on their agreement, without directly assessing Mr. Henderson's capacity. Option C. Proceed with a comprehensive assessment of Mr. Henderson's decision-making capacity, focusing on his ability to understand the information, appreciate the situation and consequences, reason through his options, and communicate his choice, while also exploring his values and goals. Option D. Respect Mr. Henderson's stated wish to cease artificial hydration and nutrition immediately, assuming his distress and pain are the primary drivers of his request, and that he is therefore incapable of making this decision. The correct answer is C. Proceed with a comprehensive assessment of Mr. Henderson's decision-making capacity, focusing on his ability to understand the information, appreciate the situation and consequences, reason through his options, and communicate his choice, while also exploring his values and goals. Explanation. This scenario presents a common yet complex ethical challenge in palliative care, balancing a patient's stated wishes with concerns about their decision-making capacity, particularly when those wishes might lead to outcomes perceived as detrimental by the healthcare team. The challenge lies in respecting patient autonomy while fulfilling the professional duty to ensure decisions are informed and capacity is intact, especially in the context of a serious, life-limiting illness that can impact cognitive function and emotional state. The APN must navigate the nuances of fluctuating capacity, the influence of pain or medication, and the patient's right to refuse treatment, even if that refusal seems contrary to their best interests as perceived by others. The correct approach prioritizes a thorough, systematic assessment of decision-making capacity, respecting the patient's autonomy as the cornerstone of ethical practice. This involves engaging in open communication, exploring the patient's values and goals, and ensuring they understand the information provided. The APN must document this assessment meticulously, including the patient's expressed wishes, the information provided, and the rationale for determining capacity. This aligns with the ethical principles of autonomy and beneficence, and regulatory frameworks that mandate informed consent and respect for patient self-determination. An incorrect approach would be to override the patient's wishes solely based on the APN's perception of what is best, without a robust assessment of capacity. This fails to uphold the principle of autonomy and could constitute a violation of patient rights. Another incorrect approach is to assume capacity is absent due to the patient's diagnosis or emotional state, without conducting a formal assessment. This is a form of ageism or diagnostic bias and is ethically and regulatorily unsound. Finally, proceeding with a treatment the patient has refused, even with good intentions, without a clear and documented determination of incapacity and appropriate surrogate decision-making, is a significant ethical and legal breach. Professionals should employ a structured decision-making process that begins with a presumption of capacity. When doubt arises, a comprehensive assessment of capacity should be conducted, focusing on the patient's ability to understand, appreciate, reason, and communicate their choice. This assessment should be collaborative, involving the patient, family with patient consent, and the interdisciplinary team. Documentation is crucial at every step, detailing the assessment process, findings, and the rationale for any decision regarding capacity and subsequent care planning. Question 9. Cost-benefit analysis shows that prioritizing the patient's clearly documented advance directive, even when it causes significant distress to the family, is the most ethically sound and legally defensible course of action for an advanced practice nurse in palliative care APN. when a patient's end-of-life wishes conflict with their family's desires. Considering this, which of the following actions best reflects the APNPC's professional responsibility in this complex ethical scenario? Option A. Immediately implement the family's preferred course of treatment to alleviate their immediate distress and avoid further conflict, overriding the patient's advance directive. Option B. Inform the family that the patient's wishes are legally binding and that their input is not relevant, thereby ending the discussion and proceeding with the patient's directive. Option C. Facilitate a meeting with the patient, if capable, the family, and the interdisciplinary team to reaffirm the patient's wishes, explore the family's concerns with empathy and education, and ensure the patient's advance directive is honored. Option D. Postpone any decision-making until the family has had more time to grieve and come to terms with the patient's prognosis, potentially delaying the patient's desired care. Correct answer is C. Facilitate a meeting with the patient if capable, the family, and the interdisciplinary team to reaffirm the patient's wishes, explore the family's concerns with empathy and education, and ensure the patient's advance directive is honored. Explanation. This scenario presents a profound ethical dilemma common in palliative care, where the APNPC must balance patient autonomy, beneficence, and non-maleficence in the face of a family's differing wishes. The challenge lies in navigating the complex emotional landscape of end-of-life decisions, respecting the patient's expressed wishes, while acknowledging the family's grief and potential misunderstanding of the patient's condition or prognosis. The APNPC's role requires not only clinical expertise, but also exceptional communication, empathy, and ethical reasoning to uphold professional standards and patient rights. The correct approach prioritizes the patient's documented advance directive and their current capacity to make decisions, aligning with the core ethical principle of patient autonomy. In palliative care, respecting a patient's right to self-determination, even when it conflicts with family desires, is paramount. This approach is supported by regulatory frameworks that emphasize informed consent and the legal standing of advance directives. The APNPC's responsibility is to advocate for the patient's wishes, ensuring they are understood and honored by the healthcare team and the family. This involves clear, compassionate communication with the family, explaining the patient's rationale and the legal and ethical underpinnings of their decision. An incorrect approach would be to yield to family pressure without thoroughly re-evaluating the patient's capacity or exploring the family's concerns. This would violate the principle of patient autonomy and potentially lead to the patient receiving unwanted or burdensome interventions, contradicting beneficence and non-maleficence. Another incorrect approach would be to dismiss the family's concerns outright without attempting to understand their perspective or provide them with appropriate support and education. This could damage the therapeutic relationship and lead to further distress for the family. A third incorrect approach might involve delaying the patient's wishes based on the family's emotional distress, without a clear clinical or ethical justification, thereby undermining the patient's right to timely and dignified care. Professional decision-making in such situations requires a structured approach. First, confirm the patient's current capacity and reaffirm their wishes, referencing any advance directives. Second, engage in open, empathetic communication with the family, seeking to understand their concerns and providing education about the patient's condition and prognosis. Third, consult with the interdisciplinary team, including ethics committees if necessary, to ensure all perspectives are considered and to reinforce the patient's rights. Finally, document all discussions and decisions meticulously, ensuring transparency and accountability. Question 10. Quality control measures reveal that an advanced practice nurse in palliative care APNPC is managing a patient with advanced cancer who has expressed a clear desire to forego further aggressive treatment. The patient's adult children, however, are distressed and believe their parent is giving up and are advocating for continued chemotherapy, which the patient finds burdensome. The APNPC has met with the patient individually and confirmed their wishes. How should the APNPC best facilitate communication and decision-making within this family context? Option A. Inform the family that the patient's wishes are paramount and that their role is to support the patient's decision, without further discussion of their emotional responses or differing opinions. Option B. Focus the discussion primarily on the medical futility of further chemotherapy, presenting this as the sole reason for the patient's decision to avoid alienating the family with discussions about the patient's emotional state. Option C. Schedule a family meeting facilitated by the APNPC, where the patient's wishes are clearly articulated, their rationale is explored, and the family's concerns are actively listened to and validated, with the goal of fostering understanding and shared acceptance. Option D. Avoid direct engagement with the family regarding their concerns about the treatment decision, focusing solely on implementing the patient's stated preferences to prevent further emotional distress for the patient. The correct answer is C. Schedule a family meeting facilitated by the APNPC, where the patient's wishes are clearly articulated, their rationale is explored, and the family's concerns are actively listened to and validated, with the goal of fostering understanding and shared acceptance. Explanation. Scenario analysis. This scenario is professionally challenging because it involves navigating complex family dynamics and communication barriers at a critical juncture in a patient's palliative care journey. The APNPC must balance the patient's expressed wishes with the family's emotional distress and differing perspectives, all while adhering to professional standards and ethical obligations. The pressure to achieve consensus and provide comfort to both the patient and family requires exceptional interpersonal skills and a deep understanding of family systems theory within the palliative care context. Correct approach analysis. The correct approach prioritizes open, empathetic, and structured communication, facilitated by the APNPC acting as a neutral mediator. This involves actively listening to all parties, validating their feelings, and clarifying the patient's goals of care. By creating a safe space for dialogue, the APNPC can help the family understand the patient's perspective and the rationale behind their decisions, thereby fostering acceptance and reducing conflict. This aligns with ethical principles of patient autonomy, beneficence, and non-maleficence, as well as regulatory guidelines emphasizing patient-centered care and effective communication in end-of-life situations. The APNPC's role is to empower the patient and support the family through this process, ensuring decisions are informed and aligned with the patient's values. Incorrect approaches analysis. An approach that dismisses the family's concerns or unilaterally imposes the patient's wishes without adequate facilitation of understanding would be ethically and regulatorily flawed. This fails to uphold the principle of beneficence towards the family, who are also experiencing distress, and can undermine trust in the healthcare team. It also risks violating the spirit of patient-centered care by not fully engaging the family in a supportive manner. An approach that avoids direct communication with the family, leaving them to interpret the situation or rely on fragmented information, is a failure of professional duty. This can lead to misunderstandings, increased anxiety, and potential conflict, which is detrimental to the patient's well-being and the family's coping process. Regulatory frameworks often mandate clear and timely communication with designated family members or support systems. An approach that focuses solely on the medical aspects without acknowledging the emotional and relational dimensions of the family's experience neglects a crucial component of palliative care. This can lead to a breakdown in communication and a failure to address the holistic needs of the patient and their loved ones, potentially causing further distress and hindering effective care planning. Professional reasoning. Professionals should employ a structured approach to family communication in palliative care. This involves 1. Assessing the family's structure, dynamics, and communication patterns. 2. Identifying key stakeholders and their perspectives. 3. Preparing for sensitive conversations by understanding the patient's wishes and the family's potential concerns. 4. Facilitating open and honest dialogue, using active listening and empathetic responses. 5. Clarifying information and addressing misunderstandings. 6. Supporting shared decision-making that respects patient autonomy and family involvement. And 7. Documenting all communication and decisions. This systematic process ensures that care is delivered in a manner that is both clinically sound and ethically compassionate, respecting the complex interplay of patient and family needs. Question 11. Risk assessment procedures indicate that a palliative care patient who is now unable to communicate their wishes due to their advanced illness has a surrogate decision maker who is struggling to determine the patient's preferences regarding further aggressive interventions. The surrogate states, "I know what's best for them, but I'm not sure what they would have wanted if they could tell me." The APNPC is tasked with guiding the surrogate through this decision-making process. Which of the following actions by the APNPC best supports the surrogate in making a decision aligned with the patient's likely wishes? Option A. Facilitate a detailed discussion with the surrogate to explore the patient's previously expressed values, beliefs, and any informal statements made about end-of-life care, helping the surrogate to infer the patient's likely preferences. Option B. Encourage the surrogate to focus solely on the immediate medical benefits of the proposed interventions, without delving into the patient's past values or potential quality-of-life considerations. Option C. Proceed with the aggressive interventions that the surrogate is currently leaning towards, assuming this reflects the patient's desire for continued fight against their illness. Option D. Advise the surrogate that the medical team will make the decision based on what is clinically indicated as the patient's best interest, as the patient is no longer able to express their own wishes. The correct answer is A. Facilitate a detailed discussion with the surrogate to explore the patient's previously expressed values, beliefs, and any informal statements made about end-of-life care, helping the surrogate to infer the patient's likely preferences. Explanation. This scenario presents a common yet complex ethical challenge in palliative care, revolving around the role of a surrogate decision-maker when a patient's wishes are unclear or in conflict with perceived best interests. The professional challenge lies in balancing the patient's autonomy, even if unarticulated, with the surrogate's duty to act in the patient's best interest, all within the legal and ethical framework governing end-of-life care. The advanced practice nurse APN must navigate potential family dynamics, differing interpretations of the patient's values, and the inherent uncertainty of predicting what a patient would want in a specific, often dire, situation. The correct approach, which involves facilitating a discussion to clarify the patient's previously expressed values and preferences, represents best professional practice because it prioritizes the principle of patient autonomy. Even without an explicit advance directive, exploring past statements, behaviors, and deeply held beliefs allows the APN to construct a more informed understanding of what the patient would likely desire. This aligns with ethical guidelines that emphasize respecting a patient's right to self-determination and legal frameworks that often grant significant weight to the surrogate's role in interpreting the patient's wishes. The APN acts as a facilitator, ensuring the surrogate has the necessary information and support to make a decision that is as close as possible to what the patient would have chosen. An incorrect approach would be to solely rely on the surrogate's current interpretation of the patient's best interests without diligent exploration of the patient's own values. This fails to adequately uphold patient autonomy, potentially imposing the surrogate's values or the healthcare team's perception of best interest onto the patient. Ethically, this can be seen as paternalistic. Legally, it might be challenged if it deviates significantly from what could be reasonably inferred as the patient's wishes. Another incorrect approach would be to proceed with interventions the surrogate desires without further investigation into the patient's prior expressed wishes, even if those wishes were informal. This bypasses the crucial step of attempting to ascertain the patient's own voice and could lead to care that is not aligned with the patient's values, causing distress to the patient and family. A further incorrect approach would be to defer decision-making entirely to the medical team without robust engagement with the surrogate and exploration of the patient's values, neglecting the surrogate's legal and ethical mandate. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the patient's capacity and the presence of a legally recognized surrogate. 2. Gather information about the patient's values, beliefs, and previously expressed wishes, even if informal, through conversations with the patient, if capable, and the surrogate. 3. Facilitate open and honest communication between the surrogate, the healthcare team, and if possible, the patient. 4. Explore the surrogate's understanding of the patient's wishes and the concept of best interest as it applies to this specific patient. 5. Document all discussions, decisions, and the rationale behind them. 6. Consult ethics committees or legal counsel if significant disagreements or complex ethical issues arise. Question 12. Stakeholder feedback indicates that certain demographic groups within the community are experiencing significant barriers to accessing specialized palliative care services, leading to disparities in end-of-life care quality. As an advanced practice nurse in palliative care, APN PC, what is the most appropriate best practice approach to address this issue, strictly adhering to the regulatory framework for this exam? Option A. Focus solely on documenting the unmet needs of these groups in patient charts and reporting these observations to immediate supervisors without further systemic investigation or advocacy. Option B. Propose immediate reallocation of existing resources to prioritize patients from identified underserved groups for all available palliative care services, bypassing standard referral and assessment protocols. Option C. Initiate a comprehensive needs assessment involving community outreach, data analysis of service utilization patterns, and direct consultation with patient advocacy groups and healthcare providers to identify specific barriers and inform targeted interventions. Option D. Advocate for increased individual patient referrals to existing specialized services, focusing on educating patients and families about available options without altering current service delivery models. The correct answer is C. Initiate a comprehensive needs assessment involving community outreach, data analysis of service utilization patterns, and direct consultation with patient advocacy groups and healthcare providers to identify specific barriers and inform targeted interventions. Explanation. This scenario presents a common challenge in palliative care, ensuring equitable access to services when resources are finite. The professional challenge lies in balancing the needs of a diverse patient population with the limitations of available funding, staffing, and specialized services. Advanced practice nurses in palliative care, APN, are often at the forefront of identifying these disparities and advocating for solutions. The requirement to adhere strictly to the regulatory framework for the Advanced Practice Nurse in Palliative Care, APN, exam means that any proposed solution must align with established guidelines for resource allocation, patient advocacy, and professional conduct within that specific jurisdiction. The correct approach prioritizes a systematic, data-driven, and collaborative strategy to address identified gaps in palliative care access. This involves engaging with relevant stakeholders, including patients, families, healthcare providers, and administrators, to understand the root causes of inequity. It also necessitates leveraging existing regulatory frameworks and ethical guidelines to advocate for policy changes or resource reallocation that benefits underserved populations. This aligns with the APNPC's role as a leader and advocate, ensuring that care is delivered in accordance with professional standards and patient rights as defined by the governing body. Incorrect approaches fail to adequately address the systemic nature of resource allocation challenges or violate professional and regulatory obligations. One incorrect approach might involve making ad hoc decisions based on perceived urgency without a structured assessment, potentially leading to bias and inequitable distribution of limited resources. This disregards the need for a transparent and justifiable process, which is often mandated by regulatory bodies to ensure fairness and accountability. Another incorrect approach could be to solely focus on individual patient advocacy without addressing the broader systemic issues contributing to access barriers. While individual advocacy is crucial, it does not resolve the underlying problem of resource scarcity or inequitable distribution. It may not align with the APNPC's responsibility to influence systemic change. A third incorrect approach might involve bypassing established protocols for resource allocation or patient referral, potentially leading to breaches of professional conduct and regulatory noncompliance. This could involve prioritizing certain patient groups without a clear, evidence-based rationale, or failing to involve appropriate decision-making bodies. The professional decision-making process for similar situations should involve a multi-step approach. First, thoroughly understanding the scope of the problem through data collection and stakeholder engagement. Second, identifying potential solutions that are both ethically sound and practically feasible within the regulatory framework. Third, advocating for these solutions through appropriate channels, utilizing evidence and professional expertise. And fourth, continuously evaluating the effectiveness of implemented strategies and adapting as necessary. This process emphasizes collaboration, evidence-based practice, and adherence to professional and regulatory standards. Question 13. Operational review demonstrates that a palliative care patient, Mr. Henderson, expresses significant distress regarding his declining functional status and a feeling of being a burden. He states, "I don't know how to deal with this, and I feel so alone." He has a supportive family but seems resistant to their direct involvement in his daily care decisions, preferring to manage what little he can himself. The Advanced Practice Nurse in Palliative Care, APN, is tasked with developing a supportive intervention plan. Which of the following approaches best addresses Mr. Henderson's coping mechanisms and support systems within the regulatory framework for APNPC practice? Option A. Immediately arrange for a referral to a social worker and a grief counselor to provide structured support, assuming his distress indicates a need for professional intervention beyond the APNPC's scope. Option B. Focus on symptom management of his physical discomfort, as addressing his emotional distress directly may be too overwhelming for him at this stage of his illness. Option C. Reassure Mr. Henderson that his feelings are normal for someone in his situation, and encourage him to rely more heavily on his family, as they are his primary support system. Option D. Facilitate a discussion with Mr. Henderson to explore his current coping strategies, identify his personal strengths, and collaboratively determine which existing or potential support systems he feels most comfortable engaging with, while respecting his desire for autonomy in care decisions. The correct answer is D. Facilitate a discussion with Mr. Henderson to explore his current coping strategies, identify his personal strengths, and collaboratively determine which existing or potential support systems he feels most comfortable engaging with, while respecting his desire for autonomy in care decisions. Explanation: this scenario presents a common challenge in palliative care, supporting a patient experiencing significant emotional distress and a perceived lack of personal agency, which can exacerbate their coping difficulties. The professional challenge lies in balancing the patient's autonomy with the nurse's responsibility to provide comprehensive support, ensuring that interventions are both clinically appropriate and ethically sound. Adhering to the principles of patient-centered care and the regulatory framework governing advanced practice nurses in palliative care, APN-PC. The correct approach prioritizes empowering the patient by exploring their existing coping mechanisms and identifying their preferred support systems. This aligns with the ethical imperative to respect patient autonomy and self-determination, as mandated by professional nursing standards and relevant healthcare regulations that emphasize shared decision-making and individualized care plans. By actively involving the patient in identifying and leveraging their own strengths and resources, the APNPC fosters a sense of control and promotes more sustainable coping strategies. This approach also acknowledges the holistic nature of palliative care, which extends beyond symptom management to encompass psychosocial and spiritual well-being. An incorrect approach that focuses solely on prescribing external support services, without first assessing the patient's readiness or preference risks, disempowering the patient, and may lead to resistance or non-adherence. This could be seen as a failure to uphold the principle of patient autonomy, and could violate regulatory guidelines that require patient-centered care planning. Another incorrect approach that involves minimizing the patient's feelings or dismissing their concerns is ethically indefensible and constitutes a failure to provide compassionate care, potentially leading to a breakdown in the therapeutic relationship and contravening professional standards of practice. Furthermore, an approach that solely relies on the family as the primary support system, without assessing the patient's own capacity or desire for other forms of support, can overlook the patient's individual needs and preferences, potentially creating undue burden on the family or failing to address the patient's unique psychosocial landscape. Professional decision-making in such situations requires a systematic process. First, actively listen to and validate the patient's expressed distress and concerns. Second, conduct a thorough psychosocial assessment, exploring their current coping strategies, perceived stressors, and existing support networks, both formal and informal. Third, collaboratively identify potential coping mechanisms and support systems that align with the patient's values, preferences, and cultural background. Fourth, develop an individualized care plan in partnership with the patient, outlining agreed-upon interventions and support strategies. Finally, regularly reassess the effectiveness of these interventions and adjust the plan as needed, always prioritizing the patient's well-being and autonomy. Question 14. The assessment process reveals a 78-year-old male patient with advanced metastatic cancer experiencing significant dysphagia, a reduced appetite, and a 10-pound unintentional weight loss over the past month. He expresses a desire to maintain comfort and avoid unnecessary medical interventions. His family is concerned about his nutritional status. What is the most appropriate initial approach for the advanced practice nurse in palliative care? Option A. Immediately consult with a dietitian to develop a high-calorie, high-protein meal plan and discuss the insertion of a nasogastric tube for supplemental feeding. Option B. Recommend a trial of intravenous fluids to address dehydration and monitor weight closely, without further discussion of oral intake or ANH at this time. Option C. Initiate a discussion with the patient and family about their goals of care. Explore the patient's understanding of his condition and preferences regarding artificial nutrition and hydration, and assess for interventions to improve oral intake and manage symptoms contributing to anorexia. Option D. Focus solely on pain management and other distressing symptoms, as nutritional interventions may be burdensome and not aligned with the patient's stated desire to avoid unnecessary medical interventions. Correct answer is C. Initiate a discussion with the patient and family about their goals of care. Explore the patient's understanding of his condition and preferences regarding artificial nutrition and hydration, and assess for interventions to improve oral intake and manage symptoms contributing to anorexia. Explanation. The assessment process reveals a patient experiencing significant dysphagia and anorexia, leading to unintentional weight loss and dehydration. This scenario is professionally challenging because it requires a nuanced approach that balances the patient's immediate comfort and quality of life with their nutritional needs, all within the ethical and regulatory framework governing advanced practice nursing in palliative care. The goal is not necessarily to cure the malnutrition, but to optimize the patient's well-being and symptom management. The correct approach prioritizes a comprehensive assessment of the patient's goals of care, understanding their wishes regarding artificial nutrition and hydration, and exploring less invasive interventions to improve oral intake and comfort. This aligns with the ethical principles of beneficence and autonomy, ensuring that interventions are patient-centered and respect their right to self-determination. Regulatory guidelines for palliative care emphasize symptom management and quality of life, which includes addressing distressing symptoms like poor appetite and difficulty swallowing. The focus is on providing comfort and dignity, which may involve modifying the route or type of nutritional support based on the patient's preferences and the potential benefits versus burdens. An incorrect approach would be to unilaterally initiate aggressive nutritional interventions, such as nasogastric tube feeding, without a thorough discussion of the patient's goals of care and their understanding of the potential benefits and burdens. This disregards the principle of autonomy and may lead to interventions that are not aligned with the patient's wishes, potentially causing more distress than benefit. Another incorrect approach would be to dismiss nutritional concerns entirely, focusing solely on other symptoms, as this fails to address a significant contributor to the patient's suffering and could be seen as a failure of the duty of care to manage all distressing symptoms. Failing to involve the interdisciplinary team, including dietitians and social workers, in developing a personalized plan also represents a failure to adhere to best practices in palliative care, which mandate a collaborative approach to complex patient needs. Professionals should employ a decision-making framework that begins with understanding the patient's values and preferences. This involves open communication about their understanding of their condition, their goals for care, and their wishes regarding interventions like ANH. Following this, a thorough assessment of the physical, psychological, and social factors contributing to the nutritional issues is crucial. Interventions should then be tailored to the patient's specific needs and goals, prioritizing comfort and symptom relief. Regular reassessment and ongoing communication with the patient and their family are essential to ensure the plan remains appropriate and responsive to changes in the patient's condition or preferences. Question 15. Compliance review shows an advanced practice nurse in palliative care, APN, is approached by a patient with a terminal illness who expresses a desire to end their life, stating they have suffered enough and have no hope for recovery. The APN has a strong rapport with the patient and understands their distress. What is the most appropriate initial action for the APN to take, considering the legal and ethical landscape of euthanasia and physician-assisted suicide within the specified jurisdiction? Option A. Immediately agree to the patient's request to facilitate their death, as respecting patient autonomy is the paramount ethical consideration in palliative care. Option B. Initiate a comprehensive assessment of the patient's decision-making capacity, explore their suffering and goals of care, and consult with the interdisciplinary team and attending physician to determine the legal and ethical permissibility of their request within the jurisdiction's framework. Option C. Advise the patient that euthanasia and physician-assisted suicide are not options available within the healthcare system and focus solely on symptom management. Option D. Refer the patient to a psychiatrist for immediate evaluation and potential intervention, without further discussion of their request with the palliative care team. The correct answer is B. Initiate a comprehensive assessment of the patient's decision-making capacity, explore their suffering and goals of care, and consult with the interdisciplinary team and attending physician to determine the legal and ethical permissibility of their request within the jurisdiction's framework. Explanation. This scenario is professionally challenging due to the profound ethical and legal complexities surrounding end-of-life decisions, specifically euthanasia and physician-assisted suicide, within the context of palliative care. Advanced practice nurses, APN in palliative care, PC, are often at the forefront of these discussions, navigating patient autonomy, beneficence, non-maleficence, and justice, all while adhering to strict legal frameworks. The APN PC must balance the patient's expressed wishes with the legal boundaries of their practice and the institution's policies, ensuring that any action taken is both ethically sound and legally permissible. The correct approach represents best professional practice because it prioritizes a comprehensive, multidisciplinary, and legally compliant process. This involves thorough assessment of the patient's capacity, exploration of all palliative care options, consultation with the interdisciplinary team, including physicians, ethics committees, and legal counsel if necessary, and strict adherence to the specific legal requirements for euthanasia or physician-assisted suicide in the relevant jurisdiction. This approach upholds patient autonomy while ensuring that the APNPC acts within their scope of practice and legal mandates, safeguarding both the patient and the healthcare provider. An incorrect approach that involves unilaterally agreeing to a patient's request for euthanasia or physician-assisted suicide without following established legal protocols and interdisciplinary consultation would represent a significant regulatory and ethical failure. This bypasses essential safeguards designed to protect vulnerable patients and ensure that such profound decisions are made with full understanding and without coercion. It violates the principle of non-maleficence by potentially hastening death without due process and could lead to legal repercussions for the APNPC and the healthcare institution. Another incorrect approach, such as dismissing the patient's request outright without exploring their underlying suffering or offering alternative palliative care interventions, fails to uphold the principle of beneficence and respect for patient autonomy. It may also indicate a lack of understanding of the patient's complex needs and the potential for effective symptom management within palliative care. The professional decision-making process for similar situations should involve a structured approach. 1. Recognize and acknowledge the patient's request and underlying suffering. 2. Assess the patient's decision-making capacity rigorously. 3. Explore the patient's values, goals of care, and understanding of their prognosis. 4. Consult with the interdisciplinary team, including the attending physician, to ensure a shared understanding and coordinated care plan. 5. Review and strictly adhere to all relevant jurisdictional laws and institutional policies regarding end-of-life options, including euthanasia and physician-assisted suicide. 6. Document all assessments, discussions, and decisions meticulously. 7. Seek ethical and legal consultation when uncertainties arise. Question 16. System analysis indicates a 78-year-old male patient with advanced metastatic lung cancer, admitted for symptom management, is expressing increasing feelings of hopelessness and tearfulness, stating, "I'm just a burden and it's all too much." He has also become intermittently disoriented to time and place, particularly at night. The APN is tasked with developing an initial management plan. Which of the following approaches best reflects best professional practice within the regulatory framework for advanced practice nurses in palliative care? Option A. Conduct a comprehensive assessment to differentiate between depression, anxiety, delirium, and existential distress, considering a multidisciplinary referral. Option B. Initiate a trial of an anxiolytic medication to address the patient's reported distress and monitor for improvement. Option C. Increase the dose of his opioid medication, as increased psychological distress is often a sign of uncontrolled pain. Option D. Reassure the patient that these feelings are normal given his diagnosis, and focus solely on managing his physical pain. Correct answer is B. Initiate a trial of an anxiolytic medication to address the patient's reported distress and monitor for improvement. Explanation. This scenario presents a common yet complex challenge in palliative care, differentiating between psychological symptoms that may be treatable and those that are part of the terminal illness trajectory. The advanced practice nurse, APN, must employ a nuanced approach that respects patient autonomy, adheres to ethical principles, and aligns with regulatory expectations for palliative care practice. The challenge lies in avoiding over-medicalization of existential distress while ensuring appropriate interventions for treatable conditions like depression or delirium. The correct approach prioritizes a comprehensive assessment that distinguishes between these conditions. This involves a thorough history, physical examination, and targeted psychological assessment tools. It recognizes that anxiety and depression can be exacerbated by physical symptoms, social isolation, or spiritual distress, and that delirium can be a sign of underlying physiological changes. By considering a multidisciplinary approach, including consultation with mental health professionals, social workers, and chaplains, the APN ensures holistic care that addresses the multifaceted nature of suffering. This aligns with the ethical imperative to provide patient-centered care and the regulatory expectation for APNs to manage complex symptom clusters in palliative care. An incorrect approach would be to immediately initiate pharmacotherapy for anxiety or depression without a thorough differential diagnosis. This could lead to unnecessary medication side effects, mask an underlying delirium that requires urgent medical attention, or fail to address the root causes of the patient's distress, such as unmet spiritual needs or existential angst. Ethically, this approach risks violating the principle of non-maleficence by potentially causing harm through inappropriate treatment and failing to respect patient autonomy by not fully exploring their experience. Regulatory frameworks for palliative care emphasize a holistic, symptom-focused approach that avoids simplistic diagnostic labels and treatment plans. Another incorrect approach would be to dismiss the patient's reported anxiety and depression as simply a normal part of dying. While existential distress is common, failing to assess for and treat potentially reversible conditions like clinical depression or delirium is a failure of professional duty. This can lead to prolonged suffering and a diminished quality of life for the patient. It also contravenes the regulatory expectation that APNs actively manage psychological symptoms within their scope of practice. The professional decision-making process should involve a systematic approach. 1. Thorough symptom assessment. Utilize validated tools and open-ended questions to understand the nature, intensity, and impact of the psychological symptoms. 2. Differential diagnosis. Systematically consider and rule out potential causes, including physical illness, medication side effects, and delirium, alongside primary psychological conditions. 3. Multidisciplinary consultation. Engage other healthcare professionals to gain diverse perspectives and ensure comprehensive care planning. 4. Patient-centered goal setting. Involve the patient and family in developing a care plan that aligns with their values and preferences. 5. Regular reassessment. Continuously monitor the effectiveness of interventions and adjust the plan as needed. Question 17. The control framework reveals that an APNPC is caring for a patient who expresses significant spiritual distress, believing that their current suffering is a form of divine punishment, and that seeking aggressive symptom management would be contrary to their spiritual path towards redemption. The patient is hesitant to accept pain medication, fearing it will interfere with this perceived spiritual process. Which of the following communication strategies best aligns with the APNPC's role in this palliative care context? Option A. Empathetically explore the patient's spiritual beliefs and their connection to their current suffering and treatment preferences, seeking to understand their perspective and collaboratively identifying ways palliative care can support their spiritual journey alongside symptom relief. Option B. Reassure the patient that their suffering is not divine punishment and attempt to reframe their spiritual beliefs in a more positive light, emphasizing that healing and comfort are also part of a spiritual journey. Option C. Gently but firmly explain that spiritual beliefs cannot dictate medical treatment and that the primary goal is to alleviate physical suffering, encouraging them to accept the prescribed pain medication for their own well-being. Option D. Acknowledge their beliefs but steer the conversation back to the purely physical aspects of their pain and the objective benefits of the medication, suggesting that spiritual matters are best addressed by clergy. The correct answer is A. Empathetically explore the patient's spiritual beliefs and their connection to their current suffering and treatment preferences, seeking to understand their perspective and collaboratively identifying ways palliative care can support their spiritual journey alongside symptom relief. Explanation. This scenario is professionally challenging because it requires the advanced practice nurse in palliative care, APN-PC, to navigate a complex ethical and communication landscape involving a patient's deeply held personal beliefs and their impact on end-of-life care decisions. The APNPC must balance respecting patient autonomy with ensuring the patient receives appropriate palliative care, all while managing the emotional distress of the patient and their family. The core of the challenge lies in facilitating open, honest, and compassionate communication that acknowledges the patient's spiritual framework without compromising evidence-based palliative care principles. The correct approach represents best professional practice because it prioritizes empathetic listening and collaborative decision-making. By actively seeking to understand the patient's spiritual beliefs and how they inform their understanding of suffering and healing, the APNPC can tailor communication and care plans to be congruent with the patient's values. This aligns with the ethical principles of beneficence, non-maleficence, and respect for autonomy, as well as regulatory guidelines that emphasize patient-centered care and effective communication in palliative settings. The APNPC's role is to support the patient's goals of care, which may include spiritual comfort and meaning-making, alongside symptom management. An incorrect approach that focuses solely on medical interventions without acknowledging the patient's spiritual distress fails to address the holistic needs of the patient, violating the principle of beneficence and potentially causing harm by ignoring a significant source of suffering. This approach neglects the regulatory emphasis on comprehensive palliative care that addresses physical, emotional, and spiritual dimensions. Another incorrect approach that dismisses or invalidates the patient's spiritual beliefs as irrelevant to medical care is ethically unacceptable. This demonstrates a lack of respect for patient autonomy and can erode trust, hindering the therapeutic relationship. It also contravenes guidelines that mandate culturally sensitive and person-centered care. A third incorrect approach that attempts to impose a particular spiritual or philosophical viewpoint on the patient, even with good intentions, oversteps professional boundaries and violates patient autonomy. The APNPC's role is to support the patient's own framework, not to replace it. This would be a failure to adhere to ethical principles of non-interference and respect for diverse belief systems. The professional decision-making process for similar situations should involve a systematic approach. First, actively listen to and validate the patient's concerns and beliefs. Second, assess the impact of these beliefs on their understanding of their illness and treatment goals. Third, explore how palliative care interventions can be integrated in a way that respects and supports their spiritual framework. Fourth, collaborate with the patient, family, and interdisciplinary team to develop a shared care plan. Finally, continuously reassess and adapt the plan as the patient's needs and understanding evolve. Question 18. Cost-benefit analysis shows that optimizing interdisciplinary team communication in palliative care significantly improves patient outcomes and reduces resource utilization. Yet a recent case highlights persistent communication silos between the APNPC, the social worker, and the physician regarding a patient's complex psychosocial needs and end-of-life preferences. Which of the following actions by the APNPC best exemplifies a process optimization strategy that adheres to regulatory frameworks and ethical best practices for palliative care? Option A. Document the communication breakdown in the patient's chart and proceed with care based on the APNPC's current understanding, assuming other team members will eventually align their efforts. Option B. Directly approach the physician to advocate for the social worker's recommendations, bypassing a formal team discussion to expedite the process. Option C. Schedule a dedicated interdisciplinary team meeting specifically to discuss the patient's case, focusing on open dialogue, active listening, and collaborative problem-solving to identify and address the communication barriers and ensure a unified care plan that reflects the patient's wishes. Option D. Request that the social worker communicate directly with the physician, thereby creating a separate communication channel to avoid further disruption to the APNPC's workflow. The correct answer is C. Schedule a dedicated interdisciplinary team meeting specifically to discuss the patient's case, focusing on open dialogue, active listening, and collaborative problem-solving to identify and address the communication barriers and ensure a unified care plan that reflects the patient's wishes. Explanation. This scenario is professionally challenging because it requires the advanced practice nurse in palliative care, APNPC, to navigate the complexities of an interdisciplinary team's communication breakdown while ensuring patient-centered care and adherence to regulatory standards for palliative care delivery. The APNPC must balance the need for efficient team functioning with the ethical imperative to advocate for the patient's expressed wishes and the legal requirements for comprehensive care planning. The correct approach represents best professional practice because it prioritizes direct, open, and respectful communication within the interdisciplinary team, focusing on collaborative problem solving. This aligns with regulatory frameworks that emphasize interdisciplinary collaboration for optimal patient outcomes in palliative care. Specifically, it upholds the ethical principle of beneficence by actively seeking to resolve barriers to care, and the principle of autonomy by ensuring the patient's voice remains central to decision-making. It also reflects the professional standard of care for palliative care, which mandates effective communication and coordination among all team members to address the multifaceted needs of patients and their families. An incorrect approach that involves the APNPC unilaterally implementing changes without team consensus would fail to uphold the collaborative nature of palliative care mandated by regulatory guidelines. This could lead to fragmented care, potential patient harm due to unaddressed team concerns, and a breach of professional ethics by undermining the expertise and contributions of other team members. Furthermore, it could violate regulations requiring documented interdisciplinary care plans developed through team consensus. Another incorrect approach, such as avoiding the issue and continuing with the current suboptimal communication, would be a failure to act professionally and ethically. This inaction would directly contraindicate the APNPC's responsibility to ensure effective patient care and team functioning, potentially leading to patient dissatisfaction, unmet needs, and a violation of the duty of care. It would also disregard the regulatory expectation for proactive problem-solving within palliative care teams. The professional reasoning process for similar situations should involve 1. Identifying the core issue, a breakdown in interdisciplinary communication impacting patient care. 2. Recognizing the APNPC's role as a facilitator and advocate. 3. Initiating a structured team discussion to openly address concerns and identify root causes. 4. Collaboratively developing and implementing solutions that respect all team members' input and prioritize patient needs. 5. Documenting the process and outcomes, ensuring compliance with all relevant regulations and ethical guidelines. Question 19. Assessment of a competent adult palliative care patient's refusal of a recommended pain management intervention, which the patient perceives as potentially clouding their mind and interfering with their ability to engage with family, requires the APN to: Option A. Document the patient's refusal and the rationale provided, and continue to explore alternative pain management strategies that align with the patient's stated preferences and values, while respecting their autonomy. Option B. Immediately involve the hospital's ethics committee to determine if the patient's refusal is medically sound, without further discussion with the patient or family. Option C. Administer a lower dose of the recommended intervention, assuming the patient will benefit from some level of pain relief despite their stated concerns. Option D. Proceed with the recommended intervention, explaining to the patient that their comfort is the priority and that the family's concerns about their suffering outweigh their stated preference. The correct answer is A. Document the patient's refusal and the rationale provided, and continue to explore alternative pain management strategies that align with the patient's stated preferences and values, while respecting their autonomy. Explanation. This scenario presents a common yet complex ethical and legal challenge in palliative care, revolving around the principle of patient autonomy versus the perceived best interests of the patient, particularly when a patient's decision-making capacity is in question. The advanced practice nurse, APN, must navigate the delicate balance of respecting the patient's expressed wishes while ensuring their safety and well-being, all within the established legal and ethical framework governing palliative care. The professional challenge lies in accurately assessing capacity, communicating effectively with all stakeholders, and making a decision that upholds both legal mandates and ethical principles. The correct approach prioritizes a thorough and documented assessment of the patient's decision-making capacity. This involves evaluating the patient's ability to understand their condition, the proposed treatment options, including the option of no further treatment, the risks and benefits of each option, and the consequences of their decision. If capacity is confirmed, the APN must respect the patient's informed refusal of treatment, even if it conflicts with the family's wishes or the APN's personal beliefs. This aligns with the fundamental ethical principle of patient autonomy and the legal right of competent adults to make decisions about their own health care. Regulatory frameworks for APNs in palliative care emphasize the importance of informed consent and the right to refuse treatment, provided the patient has capacity. An incorrect approach would be to override the patient's wishes solely based on the family's distress or perceived best interests without a formal capacity assessment. This violates the principle of patient autonomy and could lead to legal repercussions for battery or assault. Another incorrect approach would be to proceed with treatment against the patient's expressed wishes without a clear and documented determination of incapacity and the establishment of appropriate legal or surrogate decision-making processes. This disregards the patient's rights and the legal requirements for medical intervention. Furthermore, failing to involve the interdisciplinary team and document all assessments and discussions thoroughly would be a significant ethical and professional failing, hindering transparency and accountability. The professional decision-making process in such situations should involve a systematic approach. 1. Initial assessment of the patient's wishes and the situation. 2. Comprehensive assessment of the patient's decision-making capacity, involving objective criteria, and if necessary, consultation with ethics committees or legal counsel. 3. Open and honest communication with the patient, family, and the interdisciplinary team, ensuring all parties understand the patient's condition, prognosis, and wishes. 4. If capacity is confirmed, respecting the patient's autonomous decision. 5. If capacity is questioned, initiating the process for surrogate decision-making or guardianship as per legal guidelines. 6. Thorough documentation of all assessments, discussions, decisions, and actions taken. Question 20. Comparative studies suggest that a multimodal approach is most effective for managing constipation and bowel obstruction in palliative care. Considering a patient experiencing severe constipation with abdominal distension and nausea, which of the following represents the most appropriate initial management strategy for an advanced practice nurse in palliative care, APN, within their regulatory scope? Option A. Initiate a combination of osmotic and stimulant laxatives, ensure adequate hydration, and consider a prokinetic agent if nausea is persistent, while closely monitoring for symptom relief and side effects. Option B. Recommend increased dietary fiber intake and fluid consumption, and advise the patient to wait for spontaneous bowel movement before considering further intervention. Option C. Prescribe a single type of stool softener and instruct the patient to increase physical activity as tolerated. Option D. Administer a strong opioid analgesic to manage abdominal discomfort and wait for the physician to assess the patient for potential bowel obstruction. The correct answer is A. Initiate a combination of osmotic and stimulant laxatives, ensure adequate hydration, and consider a prokinetic agent if nausea is persistent, while closely monitoring for symptom relief and side effects. Explanation. Scenario analysis. Managing constipation and bowel obstruction in palliative care is professionally challenging due to the complex interplay of patient symptoms, ethical considerations regarding quality of life, and the need for individualized treatment plans. Patients often experience significant distress from these symptoms, impacting their comfort and dignity. Advanced practice nurses, APN, must balance aggressive symptom management with the patient's overall goals of care, which may include avoiding overly burdensome interventions. This requires a deep understanding of pharmacological and non-pharmacological options, as well as the ability to assess patient response and adjust treatment accordingly, all within the scope of their practice and relevant regulatory guidelines. Correct approach analysis. The correct approach involves a comprehensive assessment of the patient's bowel function, including the nature of the constipation or obstruction, duration, associated symptoms, pain, nausea, vomiting, abdominal distension, and the patient's overall clinical status and goals of care. This assessment informs the selection of appropriate interventions, which may include a combination of laxatives, osmotic, stimulant, stool softeners, prokinetics, and non-pharmacological measures such as dietary modifications, if appropriate and tolerated, hydration and positioning. For suspected bowel obstruction, further investigation and consultation with the interdisciplinary team, including physicians, are crucial. The APN's role is to initiate and manage evidence-based interventions within their scope of practice, monitor for efficacy and side effects, and escalate care as needed. This aligns with the ethical imperative to relieve suffering and promote comfort, as well as regulatory requirements for competent and individualized patient care. Incorrect approach is analysis. An approach that solely relies on a single class of laxative without a thorough assessment of the underlying cause or patient-specific needs is incorrect. This fails to address the complexity of constipation in palliative care and may lead to ineffective treatment or adverse effects, violating the principle of providing evidence-based and individualized care. An approach that delays or avoids pharmacological interventions for significant constipation or suspected obstruction, relying only on non-pharmacological measures, is also incorrect. While non-pharmacological methods are important, they may be insufficient for severe symptoms, leading to prolonged patient suffering and potentially exacerbating the underlying issue, which is ethically and professionally unacceptable. An approach that initiates aggressive interventions for bowel obstruction without consulting the physician or interdisciplinary team, or without considering the patient's goals of care, is incorrect. This oversteps the APN scope of practice and can lead to interventions that are not aligned with the patient's wishes or best interests, potentially causing harm and violating professional boundaries and ethical obligations. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough patient assessment, considering their history, current symptoms, and goals of care. This is followed by an evidence-based approach to intervention selection, prioritizing patient comfort and safety. Continuous monitoring of the patient's response to treatment and prompt adjustment of the plan are essential. Collaboration with the interdisciplinary team, including physicians, is critical, especially in complex cases or when interventions fall outside the APN's independent scope of practice. Adherence to regulatory guidelines and ethical principles, particularly regarding patient autonomy and the relief of suffering, should guide all clinical decisions.